And for our final presentation for this session, I would like to introduce Dr. Robert Harrison. Dr. Harrison is an occupational medicine physician who has spent his career answering an urgent question: what happens when workers are exposed to hazardous materials, and how do we catch and prevent that harm? His work has made him a go-to expert on the prevention of work-related injuries and illnesses. Dr. Harrison helps lead the California Artificial Stone and Silicosis Project of the California Labor Lab. Please welcome Dr. Robert Harrison.
So, I practice a couple of days a week and see patients at the University of California, San Francisco. We're part of the Center for Occupational and Environmental Health. And I have a number of workers' compensation injuries and illnesses that I treat. And a gentleman who you'll see in this video had a back injury working in a countertop fabrication shop. And he was represented by an attorney, Mark Shostak, who's a workers' comp attorney in the South Bay. In the process of his treatment for his back injury, he had a chest x-ray. And the chest x-ray showed scarring. And he was told by his primary care physician at a public clinic in San Mateo County that he had silicosis. And the synapse went off in Mark Shostak's brain, thinking, okay, he must have some occupational disease. Send him to Dr. Harrison at UC San Francisco, where I practice. So I'm giving you this introduction because it's really a poster child. We could probably talk for hours about just that step in the synapse, because if Mark Shostak had not synapsed and realized that I was an expert in occupational medicine and there was a program that we had at UCSF, Mr. Ramon would probably have been lost to follow-up. So we came in, and Dr. Shefali Gandhi is a pulmonary doctor who works with me at UCSF, and we saw him, started to make the diagnosis, helped him with his workers' compensation claim, which he eventually received for his silicosis. When I was contacted by Jenny Howroad, who's an industrial hygienist, she studies air levels at Georgia Tech University. And Jenny has a small grant from federal OSHA to make training videos for workers in these fabrication shops. And Jenny had heard of me and said, I need to interview somebody as a worker to introduce this video series. And I said, I think Mr. Ramon will agree to be interviewed. And we sure enough had enough trust with him. And we went to his house where we made this video. And it was one of the most moving experiences of my career, because I was sitting on his living room floor next to Jenny, who was producing this video, when he was being interviewed about his experience with silicosis. So you don't see me in this video, but I'm in the corner sitting on the floor with tears in my eyes as this is being made. There you go.
Mi nombre es Ever Ramón. Yo trabajé por 16 años en esa compañía. Bueno, en realidad el trabajo es muy bonito. A mí me gusta mucho el trabajo, pero yo creo que uno como trabajador no se da cuenta que el trabajo, así como es de bonito, así es de dañino también. Y eso nadie se lo explica a uno. Nadie. Porque primero estamos trabajando nomás con granite y mármol, que es natural, pero luego después al tiempo empezamos a trabajar con, que le llaman engineer stone, que trae pues mucha sílica. Y yo estuve viendo una vez que un camión trajo y vi un sticker y me puse a leerlo, y allí vi que decía que era peligroso porque se podía alojar en los pulmones y era muy dañino. Después de cierto tiempo fue que yo tuve un accidente, me caí en el trabajo, me lesioné mi espalda, pero fui al hospital. Estando en eso, me vine para la casa y el siguiente día parece, yo estaba con mucha flema en mi garganta, en mi boca, mucha flema y mucha tos. Entonces yo fui al hospital y dije al doctor que quería ver por qué tenía tanta cosa de esa. Y dijo, oh, pues no sabemos, pero te voy a referir para hacer unos exámenes. El siguiente día yo estaba para hacer los exámenes de sangre y todo en el hospital cuando me llamó la enfermera y dijo que yo necesitaba ir de emergencia. Disculpe, está duro para mí. Porque yo sí me afligí mucho. Yo pensé que ya era pues muy corto mi tiempo. Sí, sí, pero... Y después me dijo, lo que tiene es sílica, silicosis. Y yo le dije, ¿qué es silicosis? Es una cosa por lo que tú has estado absorbiendo mucho polvo en tu trabajo. Y yo en ese momento decidí dejar el trabajo. A mí nadie me dijo que lo dejara, pero yo dije, pues yo voy a salvar mi vida. Nunca me imaginé que mi trabajo me fuera a dañar tanto.
Pues sí, me afectó mucho emocionalmente porque pues si él sufre, lo que él sufre también yo sufro, porque pues lo que él siente, pues yo no tengo la enfermedad que él tiene, pero pues sí me afecta muchísimo, la verdad, y pues para mí ha sido muy difícil, la verdad, y que él a medianoche, las flemas, él se levanta, él tose mucho, le da mucha tos, y los ardores en el estómago, él se le sube cosas aquí a su garganta. Él dice que por eso, por la enfermedad que tiene, y pues sí, él pues sí batalla mucho con eso, la verdad.
Me gustaría como persona para que otras personas igual se informaran de los productos que están trabajando. Pude sentir la diferencia entre un Engineer Stone y un Natural Stone, que el Engineer Stone hasta arde la nariz. Cuando uno está respirando, arde la nariz, y el Natural Stone no es tan fuerte. Y entonces yo recomendaría, digamos, para los compañeros que están todavía trabajando en eso, que pues tengan más cuidado, que trabajen como más ventilado, usar buenas máscaras. Entonces, tal vez pedir que sean unas buenas máscaras y que haya una buena ventilación, o trabajar con máquinas que son con agua, porque hay muchos talleres que sí trabajan con máquinas que son con agua y no hay polvo casi.
Los patrones, pues que les den todo lo necesario a sus trabajadores, pues que sus máscaras adecuadas, y que pues estén como más pendientes de sus empleados.
Siento un poco de fe y esperanza a vivir, porque también no me avanzó mucho el problema de esto de la silicosis, porque me lo han dicho varios doctores que he consultado, que sí la tengo, pero no es extremada como para decir que ya estoy una persona terminal. Es mi esperanza de vida.
So Mr. Ramon settled his workers' compensation claim, and he moved to Guatemala with the money from his settlement, where I think he set up a restaurant business with his wife. Has a teenage son who also moved down there with him. Mr. Ramon is one of the more fortunate with silicosis because, as he points out, he doesn't have a terminal disease. There are now about 550 Mr. Ramon since this video was made. And as you'll see in a second, many of them have not been as fortunate, who have a really severe disease, have required lung transplants, or have died. Mr. Ramon also received workers' compensation, and what we found was only about 1 in 20 workers who are working in these fabrication shops have filed for workers' compensation insurance. He was comfortable, as you can see here, in making this video because he has legal status in California. And so many workers who we've contacted to make videos like this will either refuse or will make a video but with their faces blurred out because they're uncertain of their legal status and afraid of being arrested and deported. So it's a really challenging situation. I've been working on this with a team of about probably a couple of dozen people. As you heard, I'm a clinical professor at UCSF, where I've been in practice, and I'm a public health medical officer with the California Department of Public Health, and our branch tracks cases of work-related silicosis and disseminates guidelines for workers and employers. So we all probably know this store where we might go to shop and choose kitchen countertops. The chances are very good that we will choose a product called engineered or artificial stone that is made of more than 90% very finely crushed crystalline silica, called silica flour, that's combined with a polyester resin and many different pigments that give us the different colors and patterns that we want to choose for our kitchen counters. After we choose our countertop, these large slabs are moved from an import warehouse to a local fabrication shop to cut, grind, and polish to the shape that we need. So that's what Mr. Ramon was doing. Here's a picture of a worker who is grinding and polishing the cutout for a sink. You can see the very fine dust on the surface. The worker has a cartridge respirator that is covered with dust and is not adequate to protect him from inhaling silica dust. The silica dust lodges in the lungs and causes severe silicosis, which is a scarring of the lungs that can be very rapidly progressive and has no cure. In recent years, this product has become increasingly popular. The graph here shows U.S. imports of quartz surfaces. That's another term for engineered stone. From 2008 to 2018, there was an increase of 600%. And I've seen some more recent projected growth in this product. And it's estimated worldwide to be about a $35 billion business by 2030. These products go by many different names according to the manufacturer, and about 70 to 80% is imported from other countries where it is manufactured, especially Vietnam, India, and Thailand. The first case of silicosis in the United States, thank you, was reported in 2015 by a pulmonary doctor in Texas. And you could see the Morbidity and Mortality Weekly Report here from 2015 from Dr. Gary Friedman. The pulmonary doctor had written a comment on a NIOSH, the National Institute for Occupational Safety and Health blog, saying he had a case in a young man who worked in a fabrication shop. This lung specialist had some training in occupational disease and had obtained a work history, something that many primary care doctors do not usually do. In fact, some cases of silicosis are initially misdiagnosed as sarcoidosis, a granuloma, a scarring of the lung, or tuberculosis. Because of what was being seen worldwide, and since imports driven by consumer demand of engineered stone had increased in the last 10 years in the United States, the California Department of Public Health started looking for cases. The first case was uncovered by a hospital discharge record in 2019. You can see at the very end of that curve, right, the end of that line. But you can see that this case had been diagnosed 6 years earlier, in 2013, by his lung doctor, and his condition worsened until he was hospitalized and died in 2018. This case, along with several others from the same workplace, as well as others in Colorado, Texas, and Washington, were reported in 2019, also in the CDC Morbidity and Mortality Weekly Report. And that was the largest number of cases reported to that point in the United States. I think there were 18. Cal OSHA then launched a special program in 2019 to inspect these fabrication shops and check for silica dust levels. You can see the large percentage of these shops that had levels of silica dust above the allowable limit. And this is the allowable limit of 50 micrograms, averaged hour and 8 hour day. And these purple dots are the ones above the 50, and you can see that there's one shop that's close to 500. Sorry, one shop that's close to 500. Sorry about that, wandering from the mic. In 2023, Cal OSHA also tightened up their rules for controlling silica dust, requiring water, a specific area of the shop, and a higher level of respiratory protection, something called powered air purifying respirators. Dr. Jane Fazio, a pulmonary physician at UCLA Olive View, which is the county hospital in Los Angeles, began seeing many silicosis cases in her clinic. Many of her cases lived and worked nearby in the San Fernando Valley. Dr. Fazio published on 52 cases in August of 2019. These were almost all young Latino immigrants. The epidemic curve from Dr. Fazio's article is shown on the right. And one of the earliest papers from Israel, published in 2012, is shown on the left. You can see how similar they look. The Israeli cases were from Caesarstone, were caused by Caesarstone, one of the first companies to produce these products on a large scale. They have a manufacturing facility in Israel. So here we are as of April 23rd. So just earlier this week. This is a dashboard that's published and updated weekly by the California Department of Public Health. And you can see now there are 547 cases. That's the upper left there, with 30 deaths. You can see in the little purple bars there in the lower left, a little hard to see maybe from the back of the room. There have been 58 cases that have undergone a lung transplant, with another 51 that have been referred and are waiting for lung transplants. 21 who were ineligible for lung transplants. That means that their cases are really too far gone and they have other medical complications. And you can see here that they are occurring in many counties across California. That's the map at the lower right, with the greatest number in Southern California. And I want to emphasize that as alarming as these numbers may be, they are likely to be an underestimate. For every worker we have identified with silicosis, there are more who have not been screened, whose symptoms have gone undiagnosed or misdiagnosed, or whose cases have not yet been reported to public health. Australia, starting about 5 or 6 years ago, had a similar epidemic of severe silicosis caused by engineered stone. And they set up a government-sponsored medical testing program. The doctors found over 1 in 4 workers had silicosis, 25%. The Australian occupational health authorities reviewed the evidence about whether regulation and enforcement could work to prevent silicosis. And they concluded in 2023 that this was not feasible given the level of sophistication and technology and process that it would take to consistently and adequately prevent workers from exposure in these shops. Thus, the Australian government concluded that the most practically implementable health protective measure was to ban the fabrication of artificial stone countertops containing more than 1% crystalline silica. Since that ban went into effect across Australia in January of 2025, so it's been a year, about a year and a half now, there are many safer alternatives on the market. I was in Australia in November and I took this photo in one of the big box stores in Australia called Bunnings, which is like the Home Depot of Australia. Here's a picture of the display in one big box store in Australia. Many of these alternative products are made from recycled or crushed glass that has a different type of silica called amorphous silica. And these alternatives rapidly replace the crystalline silica countertops in Australia. So have a lot of choices for consumers, but you won't find engineered stone containing crystalline silica in Australia. In December of 2025, the Western Occupational and Environmental Medical Association WOEMA or WOMA, which is the organization of about 500 or 600 occupational medicine doctors in the 7 western states, asked or petitioned the California Occupational Safety and Health Standards Board to prohibit the fabrication of engineered stone containing more than 1% crystalline silica. So that was under the same definition as had occurred in Australia. This is intended to change the California OSHA rule to phase out the product in favor of safer alternatives. The Standards Board will be voting on this petition on May 21st, 2026, a little less than a month, in the Ronald Reagan Building in downtown Los Angeles. So with that, we'll end, and I guess we'll take questions during the panel. Thank you.